Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, everyone. Happy Thursday. Welcome to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health agency serving Dade, Broward, and Palm Beach County. For more information, you can reach them at 954-717-7027 or info@allcountyhealthcare.com. Tonight, we have a special guest joining us. We've got Dr. Peter Kowey, MD. He is the author of Failure to Treat: How a Broken Healthcare System Puts Patients and Practitioners at Risk. Dr. Kowey is the William Wyckoff Smith Chair in Cardiovascular Research at the Lankenau Institute for Medical Research, Professor of Medicine and Clinical Pharmacology at Thomas Jefferson University, and former Chief of Cardiovascular Diseases at Lankenau Heart Institute. Dr. Kowey earned his medical degree from the University of Pennsylvania and completed advanced training at the Harvard University School of Public Health. An internationally recognized expert in heart rhythm disorders, he has published more than 450 scientific papers, trained hundreds of cardiology fellows, served on FDA advisory panels, and received numerous national honors. He is also the author of Failure to Treat: How a Broken Healthcare System Puts Patients and Providers at Risk. Dr. Kowey, welcome to the show.
Dawn, thanks for having me. It's a pleasure to be here.
Thank you so much for joining us. I need to ask you, what inspired you to write Failure to Treat?
My mentor is a Nobel laureate named Bernard Lown, who inspired me through my career, trained me very well, and towards the end of his life was quite ill and had a number of very bad experiences with the healthcare system. He was not receiving the kind of care that he was customary for him to deliver. And we had a long conversation, and I thought about the fact that this very notable person wasn't being cared for very well. That obviously means that so many other people in this country are not receiving the care that they deserve. And I thought that at this point in my career, after having taken care of patients for over 40 years and having this much experience in academic medicine, that it was my responsibility to speak up, and that's what inspired the book.
All because of one story. Now, your book is filled with stories.
Yes, it's 20 true, anonymized stories about practitioners and patients who were harmed by something that happened in the healthcare system.
And you think Failure to Treat, you talk about the broken healthcare system on both sides, for patients and practitioners.
Yeah, I think it's important. Yeah, no, I think that's a very important point. I chose to aim it at both because I think each side of this, of this divide, doesn't totally appreciate what's going on the other side. Patients don't understand many times what doctors are going through, and doctors, because they're so busy and taken up with their responsibilities in patient care, don't necessarily think about what the patients are going through. So I thought it was a good idea for each of us to become much more acquainted with what the issues are for the others.
Do you think the doctor-patient relationship has changed over the years from when you began practicing to now?
Oh, I think there's been a dramatic change in the way that we relate to our patients. And it isn't because people who go into medicine are any less motivated to be kind and caring people. It's because the system doesn't allow them to have the time and the opportunity to deliver the kind of care that they'd like to deliver. Private practitioners, many years ago when I was young, spent a lot of time with their patients, answered their questions, and took care of them. But what's happened over the last, say, 10 to 20 years is we've had so much technology, so many changes in the delivery system, that it's really hard for doctors to find the time and the opportunity to do the kinds of things that patients really want them to do.
What do you think are the biggest systemic issues? Do you think it's the time and finances of it, or is it deeper?
No, I think it's multifactorial. There's lots of reasons for this. Financial's an obvious one. We don't pay physicians to do bedside care as well as we should. We reward physicians for doing procedures and operations, and that incentivizes them to do even more of those things, even sometimes when they might not necessarily be totally required. And I think the other thing that really has hamstrung us is that because of the need to generate revenue, we spend progressively fewer minutes with our patients. So think about a primary care doctor, and we talked about this the other day, Dawn, about a primary care doctor who has 10 minutes to see a patient who has 10 different problems. It's almost hopeless, and it's almost impossible to think how that primary care doctor is going to make a difference in that person's life because they just simply don't have the time.
Now, primary care, pediatrics, family practice, they're not necessarily procedural based. So their revenue is coming from that visit and what insurance is going to cover. What do you find what's happening with that, with those practices? Because primary care, they're the gatekeepers of everything else and every referral that goes out.
Yeah, if you look at, if you're discriminating them accurately, if you look at specialties like endocrinology, for example, and neurology, where there aren't a large number of procedures for the physicians to carry out, they're much less attractive to young people training in medical school. And so we have had a tremendous shortage of those specialties, primary care, as you mentioned, pediatrics especially. And we really have gotten to the point now where it's very difficult for people to find a primary care physician who has the opportunity to see new patients. And we've now seen an increase in reliance on physician extenders like physician's assistants and nurse practitioners. They are terrific people. They do great things, but they are not physicians. And they for them to operate exactly like a physician is a little bit, I think, it's asking a bit much of them.
And how are you finding that insurance denials, prior authorization, pre-certifications, are they affecting patient outcomes? And if so, how?
Well, there's several ways. One obvious way is that insurance companies will frequently deny either a drug treatment or a device or an operation or some kind of treatment for a patient, making that decision based on the cost and their judgment as to whether or not it's necessary. It's not a very pleasing situation, especially since if a physician disagrees with the insurance company, they need to spend a tremendous amount of time appealing that decision and trying to get it reversed. And that obviously sucks up a lot more of the physician's time, as we've already talked about. They're challenged. It creates also a barrier between the physician and the patient. So the physician can't directly deal with the patient because they have to secondarily make sure that the insurance company has the credentials, has the information that they need in order to make a treatment available.
And I would think the litigious nature of our society, you as a physician, you want your patient to receive a procedure or an injection, whatever it is. Then you have to go through all these hoops. If the insurance company or Medicare denies this treatment and there's a maloccurrence for this patient, you as the doctor are just as responsible to in the patient's eyes, whether you are or not, as the insurance company. So what does that look like as the physician? You're trying to care for the patient, you're trying to make sure they're all pre-authorized, and then you have to deal with insurance, and you're not getting reimbursed to talk to the insurance company.
Yeah, it's sort of the perfect storm, isn't it? putting all of these things together, it makes the relationship with the patient much more difficult. And yes, what you said is exactly the case. If we don't succeed in finding treatments for our patients, even if it's an insurance company impediment, we are still responsible for that. Insurance companies cannot be sued in a malpractice action. They are immune from that kind of legal challenge. And so it's the physician who is ultimately responsible for what happens to the patient. We assume that responsibility. I welcome that responsibility, but in many situations, we've had to compromise the way we take care of patients to their detriment. And there's a story in the book about a woman who had a cardiac rhythm abnormality who was perfectly well treated with the medication. It was given to her as samples, but when she tried to purchase it, her insurance company denied it, and it forced her into a situation where she had a procedure with a bad outcome.
And then also, those are the stories that you have in the book. There are stories of different administrative issues, different medical issues. And the message is to what? Bring awareness, to make a statement?
Yeah, it's the first more than anything else. I think before we're ever going to get to a point where we can change things, people have to understand what the problem is. And there's so much noise out there about issues that we're talking about that I think it's created a good deal of confusion, not only among the public, but also among physicians. And what I try to do is to use stories, which are, by the way, is kind of an ancient way for medical education to proceed. We tell stories, we present cases, that's the way we learn in medicine. So it's a very familiar genre for physicians. And the stories are written in a way that they're perfectly understandable to the public as well, but through the stories, make points about what are the things that are getting in the way of good patient care. And each of these stories ends with some recommendations about how the situation might be fixed. So we don't end on a negative note. We end with some ideas about things that patients can do, physicians can do, in order to make the situation somewhat better.
All right, and on that note, we're going to take a quick commercial break. More with Dr. Peter Kowey, Failure to Treat, How a Broken Healthcare System Puts Patients and Practitioners at Risk. The book is available on Amazon.com, and more to come on the other side of the break. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. For more information on All County Healthcare for you or your loved ones, you can reach them at info@allcountyhealthcare.com or 954-717-7027. Tonight we're joined by Dr. Peter Kowey. He's the author of Failure to Treat, How a Broken Healthcare System Puts Patients and Practitioners at Risk. Dr. Kowey, thank you again for joining us. Tell everyone listening how they can get your copy of your book.
Well, as you said, Dawn, it's available on the usual outlets, Barnes & Noble and Amazon. It's actually an Amazon bestseller. We've been very pleased with the response that readers have had to it. And you can also visit my website at peterkoweyauthor.com for more information about the book, but also some links to podcasts and some other interviews that give you more information about the stories in the book.
What are you hoping putting this book out will do for healthcare for patients and practitioners?
Well, I'm hoping that once people understand what the issues are and clearly understand them as best they can, that they will be galvanized and motivated to appeal to their legislators, to the legislative leaders in this country, to finally begin the process of finding our way to making sure that everybody who lives in the United States has access to health care. I mean, it's really kind of a national disgrace that we're now facing large percentage of individuals, and these are not necessarily people who are very poor. As many of these people are in middle income groups who simply cannot afford health insurance. They're making decisions between eating, and putting gas in their car and trying to have some kind of health insurance. And relatively young people who think that nothing's going to happen to them are going bare without insurance. It's a situation that is really getting to a crisis level, because these people will be afflicted with diseases that are going to grow in severity to the point where they become catastrophic and further burden the healthcare system.
Do you think part of that is the increased rise in prescription drug costs as well?
Oh, drug costs are ridiculous. Everybody in the world knows that people in the United States pay up to 2 to 3 times, and sometimes even higher times, the amount that's paid by people, for example, in European countries for the same medications. And part of that is because we just simply don't regulate it. We don't regulate the industry and force the industry to justify the kinds of prices that they put on drugs that they freely advertise on television. And the costs of direct-to-consumer advertising, that multiplies the cost of the drugs that we have to have for our patients. It's a situation that has become untenable.
And you talk about physician burnout, which is the other side of the coin from patients and the economy. I'm sure people are listening thinking, why and how could a physician burn out, right? The consensus is they're paid well, they're well taken care of. You make the phone call to the insurance company. We now have EMR, which you would think would make it easier for the practitioner. But does it in fact?
So that was one of the stories in my book, where it was about a woman who practiced medicine and got to the point where she simply couldn't keep up with all of the things that she needed to do, and had a crisis and decided to go into this concierge idea, leaving some of her patients behind. If you can get into the mindset of a physician and nurse for that matter, and burnout, by the way, occurs in the nursing community as much or even more than in the physician community. But if you get into their mind, these people are very, very motivated to make sure that patients get the very best medical care. And when they see situations in which they simply are not able to deliver that care, it makes them very stressed and very anxious and depressed. And that is what physician burnout is. Physician burnout is grinding through a system that isn't going to work for the patient, and watching bad outcomes. There have been a number of nursing strikes in Philadelphia over the last couple of years, and when you ask the nurses on the picket line, why are you out here? It's not because they want to make more money. It's because they're worried that the patients they're taking care of are not being cared for adequately because there's simply not enough staff. And that's one of the crises that we're facing and obviously need to address.
Do you think part of this can be addressed in the medical education process, the healthcare education process, nurses included? And how so?
Yeah, medical education is also in a crisis. And part of the reason is what we've been talking about, is that doctors not only don't have time to spend with each of their patients, they don't have time to read, they don't have time to go to conferences or to keep up. And therefore, especially in the primary care world, physicians are behind in their learning and not necessarily as up to date as they should be. We've also had a crisis in medical school education because we've been emphasizing many of the wrong things in the medical education process. I don't know if you saw, but very recently, the AAMC, which is the governor for medical education and medical schools, has finally made a strong recommendation that medical schools include nutrition training in the curriculum. Now think about that. For many, many years, doctors were getting out of medical school, and I am one of them, who came out of medical school not really having a comprehensive knowledge about nutrition. I mean, how ridiculous is that? Nutrition is one of the fundamental pieces of how we should be taking care of our patients. So there's lots of things in the medical education system that it would not be difficult to change, but need to be addressed.
And looking ahead, what worries you the most about the future of healthcare?
I think we're at a crossroads, really, where we have to make a decision about, as a society, about how much we're willing to spend in order to make sure that people who really need it get the medical care that they require. We're spending this, in 2025, we spent somewhere in the neighborhood of $5 to $6 trillion on medical care in the United States. I just saw something today. The extrapolation is that by 2035, we'll be spending $9 trillion on medical care. It's an enormous amount of money per capita, and yet that money is going all in the wrong places. It's going into the pockets of private equity, of large pharmaceutical companies, of medical insurance companies that are grinding the system, and they're not going where they're supposed to go into direct patient care. That situation needs to change, but the only way it's going to change is through legislation. So if we're ever going to get this fixed, it's going to be when the public finally says to the politicians running for political office, what have you done for me to make my medical care better? Why haven't you made my medical care better? And if you haven't, then I think you need to find something else to do with your time. We don't want you representing us further.
It's really interesting because after we spoke the other day in studio, the Pediatric Associates, one of the large pediatric conglomerates in Florida, they just sued the state for Medicaid because they're saying that if they don't increase the Medicaid reimbursement to these pediatricians, the bulk of the children in this state are not going to have care. And they said they tried to have meaningful conversations and they tried to mediate and they tried to meet face to face and say our youth is at risk. And I don't know what happened. I wasn't in the meetings, but a lawsuit has now been filed because so many people, the underserved, we talked before, the haves have access to concierge and better quality care. Those that are on limited, reduced economy scale, they're having a harder time. And now if our kids are not able to receive care, what are we doing?
Yeah, it really, when you start talking about it the way you just said it, Dawn, it actually makes you cringe, doesn't it? That as a society, we've made a decision that we're going to allow 30, 40, 50% of our citizens, people who live in the United States, we're going to let them go without any kind of access to any kind of medical care. I mean, the truth is that when they get really, really sick and they go to the emergency room, they're not going to get thrown out of the ER. They'll get cared for, but it's going to be at a later stage of the disease. Our emergency rooms are already crammed. It's just not the way that we should be delivering medicine. We need, as I said, to have, and I'm not talking about, the very best level of, the Cadillac care. I'm talking about basic stuff. The ability to go to a primary care doctor, the ability to get your medications, the ability to go to the emergency room when you're sick, the ability to get your kids vaccinated when they need to be vaccinated, the ability to get them to the pediatrician when they're ill. These are basic rights. These aren't privileges. These are rights that every citizen in the United States, everybody who lives here, really needs to have access to. And we've been talking about this for a long time. Obama tried to solve the problem, but Obamacare was sort of a patchwork system that many people are unhappy with. We need to have universal health care for people in the United States, and until we do, I'm afraid we're not going to make any headway.
it's a huge ripple effect, right? With kids, with elderly, someone's got to leave work to get them to the physician, and then you can't get the prescription right. You need a gatekeeper. You need someone to oversee what's going on, and then there's no reimbursement. We've got about 2 minutes left. What's your overall message of hope, right? Because right now we painted a pretty bleak picture of what's going on. There has to be hope. What is your message of hope?
Well, I firmly believe that we still have a very large number of young people in this country who are very interested in going into healthcare. They want to take care of people. I have a granddaughter who just graduated from nurse practitioner school. We're so proud of her that she's willing to go out there and take care. She's very interested in women's health, taking care of women who are ill or women who have obstetrical needs. So I'm optimistic that we have people who want to do the right thing. We just need to get out of their way. We just need to facilitate what they do. And if we can take all of the right things that they want to do and put them into action, I think we still have tremendous potential here. But if the system continues to burden physicians and nurses and healthcare providers with all the regulatory things, the malpractice sphere, all the health insurance company nonsense, we're going to continue to have people leaving the profession, or they're going to be working shifts, and they're going to be not as dedicated to the principles that they had when they were in their medical training. So there's still lots of opportunity, but we need to act very, very soon.
Thank you so much for your time. This book is enlightening. I think it gives everyone a fresh perspective on what's really going on both sides of the equation, and not only the political side, but really how it's affecting patients and practitioners and families. Again, tell everyone, what is the best way to get a copy of the book?
Well, again, Amazon, as usual, is the outlet. But in addition, peterkoweyauthor.com is a good resource for people who want to learn more about this problem. I want to thank you, Dawn. It's very important for people like you and your station to put these issues forward so that people can understand them. It's really a very critical time for us.
Agree. Dr. Kowey, thank you so much for your time.
Thank
you, everyone, for joining us this evening. All County, you and your doctor. All County Healthcare is a Medicare certified home health agency. If you need their services for you or your loved one, reach out in South Florida, 954-717-7027 or info@allcountyhealthcare.com. I'm Dawn Graubert. Have a great evening, everyone. Until next week, we'll see you then. Bye-bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be